declaration to declare pecuniary interest? Seeing nothing, we can move on, and we've got the overview of the COVID-19 updates in Grey County long-term care. Jennifer, are you taking us through that?
Yes, I will. Can you hear me okay?
We can hear you.
Okay.
COVID-19 updates in Grey County long-term care. Jennifer?
Okay, that was fun. No, I don't. That's okay. Technology. All right. So I have
the floor is yours.
Okay, great. Thank you. Thank you, Councillor Mackey. So I am going to go through the report that was circulated yesterday. The 3 long-term care homes started to prepare for the possibility of COVID-19 reaching our area in January. As the news coverage increased and health officials stated that hand hygiene was one of our best defenses, our 3 homes implemented hand hygiene, we reintroduced and re-educated hand hygiene audits to be completed on a regular basis. The first week of February, we reminded our staff of the importance of hand hygiene and the steps that were involved to prevent the spread of infection. Influenza cases were in the community, so we, as we always do, enhanced our cleaning and also created additional educational posters for staff and visitors addressing the importance of staying at home when you are unwell. Screening tools for visitors to the home have always been in place since SARS. And on March 12, 2020, when we were instructed to implement active screening for staff and visitors, we communicated that through MailChimp as well. We quickly arranged for a 24-hour screening station, and staff and visitors were asked a series of questions based on their health and travel history in the last 14 days or the 14 days prior. Entrance was only permitted through one door, and that continues to be the case. Residents were discouraged from leaving, and all group activities were canceled. Additional education was provided to staff to refresh their PPE techniques and infection and prevention and control strategies and knowledge. On March 13th, regular leadership team, long-term care committee, public health, and Advantage meetings began. And by the end of the day, direction was received to restrict all visitors except for essential visitors. This measure was quickly implemented and communicated to families in the community through the MailChimp subscription that we use to send out communications. To prepare for future needs of the homes, our department prepared a training booklet that meets ministry training regulations. Departmental meetings with human resources and economic development were held to discuss the redeployment of staff. Immediately, economic development provided 15 staff members. They were trained and began working in all 3 homes. I can't say enough how grateful I am for those first 15 people to put their hands up, and the support from HR and Savannah. It's been wonderful, and they really led the way on this. As Kim mentioned in the previous meeting, redeployed staff are now working as screeners and are also helping with other tasks in the homes. On March 19th, we implemented new COVID-19 policies, and we began planning isolation areas, taking inventory of supplies, and thinking about social distancing measures and how our residents can stay connected. The Color at Connect program was initiated and was well received by all homes and families and residents. On March 23rd, another provincial directive is received, and residents were instructed to remain in the home. Our screening tool was updated to ask if staff members work in multiple locations and to identify the last date worked. We continue that as our regular screening, and I'll speak later to our measures to cohort staff. On March 26th, we reached out to the RNAO, which is the Registered Nurses Association of Ontario, and registered our homes for nursing students. We're working with EMS on ordering supplies, and we're received temporary licenses for our 5 unfunded beds. Our homes have since moved residents into these additional beds, and that provides some support and relief for the hospitals as they begin to prepare for a surge in their patients. March 27th, the homes were instructed to have social and physical distancing plans in place. All 3 homes are either providing room service, so in-room meal service, or have spread out their dining areas so that only 2 residents sit at a table and allow for that physical distancing. Directives change continuously, and to stay ahead, I've asked the homes to also implement a process that allows staff to change into and out of their uniforms at work in order to reduce the risk. And the homes are also submitting a daily summary. There's a daily reporting form that the EDs are completing with their teams, and they're submitting them, and we're able to then have a daily summary of what the impact is on the home. It covers a number of areas: PPE supply, staffing challenges, shortages, screening initiatives, anything that's going on with residents affected, staff affected. It's been a very helpful tool in us preparing and making plans for the next day and the days after that. On March 31st, the homes were instructed, it was new directives still again, to start taking the temperatures of staff at the beginning and the end of their shift. Residents are also being actively screened with their temperatures being taken. Each home's medical director has sent out a letter that addresses end-of-life medical directives and supports families and residents in having further discussions around the end-of-life decisions that may have to be made and will have to be made if in fact we end up in a COVID outbreak. There's been a lot of discussion regarding wearing surgical masks, and as of last week, all staff are donning masks at all times. This is in an effort to protect our residents. And I would just like to note that a directive arrived this morning or overnight, issuing that directive across the province. We started that in partnership and with direction from Public Health last week. Additional COVID and end-of-life education has been uploaded on our e-learning platform. And virtual staff and family meetings were held last week and again this week with a question and answer section. The virtual family meeting is this evening at 7. These meetings will be arranged each week to keep the lines of communication open and address any concerns people might have. This week, I have asked the homes to start the process of further cohorting of staff and to create isolation areas as preparation for positive cases. The homes have also created a 2-team leadership schedule and have assigned backups for each of their positions. The leadership teams are in the home leading and working alongside frontline staff 7 days a week. And the teams have been amazing. They have stepped up, and the work that they're doing is just incredible. I am fortunate to sit on a number of committees: South Bruce Grey, Long-Term Care Committee, Southwest Regional Non-Hospital Pandemic Planning Group. There are 5 of those in the province, 5 of those types of groups: the Southwest Regional Long-Term Care Hospice Planning Committee and the Grey Bruce Integrated Health Coalition. This active involvement with these committees and along with Public Health allows our homes to be fully aware and up to date of the ever-changing directives and initiatives. Additionally, the Long-Term Care Department has been very well supported by the CAO, Corporate Services, and the Senior Management Team, and the Emergency Control Group. The leadership teams have very capably received, distributed, and facilitated directives, strategies, and plans within their homes. Staff have quickly adapted to changes while continuing to look after the care and emotional needs of the residents, doing their best to color it for them every day. The residents and families regularly express their gratitude and appreciation for the daily efforts in keeping them safe. In looking ahead, we're actively working on staffing strategies, planning and implementing outbreak protocols, managing and monitoring our PPE supplies, and ensuring ongoing communication with residents, families, staff, and the community. And I'm happy to answer any questions.
Okay, Jennifer. Well, certainly on behalf of the committee, thank you very much to you, the executive directors, Kim, all of the staff, and to the county staff that are stepping up and helping out in long-term care. Certainly our sincere appreciation. Any questions from the committee?
It's Christine, if I might, Mr. Chair.
Go ahead, Christine.
Thank you. And I absolutely will echo your comments. Jennifer, thank you very much for all of your hard work, your staff, and certainly Grey County staff, and extended congratulations and thank you to, not congratulations, but thank you to our CAO for the county. My question is, for clarity purposes, long-term care staff that are working in a particular home do not or are not required to work at another long-term care home within our county long-term care homes. So if you're working at one, you're not required to work at one of the other Grey County long-term care homes.
Through you, Mr. Chair, I don't even know where to look. Through you, Mr. Chair, I'll answer that question. So under normal circumstances, the collective agreements at this time do not facilitate staff working in more than one of our Grey County locations. However, there have been a number of emergency orders put into play by the province that do allow some flexibility in that regard. Having said that, we are working at minimizing staff working in more than one location, not just between our 3 homes, but many staff work in more than one location. So we are undertaking the work now and have been we have a list of who works in more than one location. We have a plan and strategy in place to determine if they've been working at a location that is an outbreak, then we would be focusing on cohorting people between working. They would not work in a place that has an outbreak and then go and work in a place that does not. So just if in fact there is a surge and we find ourselves in a situation where one home has a number of COVID cases and the other 2 homes do not, we may find ourselves in a point where we could ask staff to work. They've been working in a COVID space. They are working in that location, and staff that have not been exposed will work in the locations that do not have COVID. However, that is just a planning strategy at this point. And I should update, I didn't include it in the list, but at this point, we do not have any positive COVID cases in any 3 of our long-term care homes. That includes residents or staff. And the recent directives have been updated that an outbreak is declared with 1 positive lab confirmed positive case, be it a resident or a staff member. And if that's the case, if there is 1, then the home goes into full outbreak protocols.
Thank you.
Mr. Chair, I have a question.
Yes, go ahead, Brian.
So these 15 people that came from economic development, did that take cooperation from the union side too to allow that to happen, or is that all part of the emergency?
Well, it is part of the emergency. However, the homes were working and strategizing on staffing strategies before COVID. So the increased duties with the Color It Connect program is what we started with. So that's the setting up of appointments with families to do virtual visits on a Skype or FaceTime. So those folks supported that work, but we had discussions with the union. We've been discussing our strategies throughout all of this with the union representatives. And the commitment that we've made is that any additional work goes out to all of our unionized staff first, and then it goes out to our redeployed folks and after that.
Okay, and just reading the newsletters last night, it looks to me like the workload has increased with some of the things you're doing. You're doing extra, games, you're delivering meals to each individual room. Is that taking its toll? Do you have enough staff, or what kind of, it seems to me that there's more work going on.
Absolutely, there is definitely more work. All of the work that normally happens in long-term care continues to happen with the additional layer of all things COVID on top of that. So we have increased the staffing hours. If there were homes that had short shifts, we increased them to full shifts. In some of the strategies around additional cleaning, if there was a home that had 2 housekeepers that might have crossed over into 2 home areas, we've increased hours so that they are cohorting onto only 1 home area. So staffing is something that we are monitoring daily, regularly, and doing our best to enhance and provide support using these newly trained redeployed staff to support the additional work that needs to be done on the floor to make sure that the residents are getting the care that they need.
Okay, thanks, Jennifer.
Are there other questions from the committee? Barb?
There, I couldn't get myself unmuted. Thanks so much. First of all, Jennifer, oh my goodness. Thank you so much to you and all your staff and the executive directors for the homes. It's just a good news story, and I know you're working so hard to keep everyone safe there. I'm just wondering, with the so sad and unfortunate news we've heard across the province, if we've had any request to remove any of your clients from our homes, and if this should become a problem or should become an issue, what is the story going to allow them to come back in or not? Do they go to the bottom of the line?
So I'm glad that you asked that question. I am anticipating that question on the family call this evening. So I had just reached out to our colleagues in Lynn Home Care just to confirm. So I believe in the homes there have been some discussions, although no one has opted to take anyone home. Most of our residents in long-term care require that 24/7 care, and it would be an undertaking for families to be in a situation where they could comfortably and safely provide that care for any length of time. So that has not taken place. If in fact someone does choose to take their loved one home, their bed is released and put back into the pool, and another resident will be matched to that bed. At this point, the legislation has been adjusted that they can reapply within 3 months and they will take priority on the list. However, they will have to reapply. They will be able to reapply and they will get bumped up. But it's hard to say what that impact would be on what their wait time would be.
Right.
I thought the direction that I saw in one of the things you shared this morning, Jen, just to confirm that the idea that you could take them out for a while and bring them back again is just not on.
That's right. Once they have left, they are not to be readmitted.
Understood. Thank you.
Jennifer, the premier yesterday talked about increased testing. Do you think there will be testing done of our residents and staff?
Yeah, so that directive is part of what came out overnight. So what is new in that directive is what was in place before is that any resident who is symptomatic, so as soon as they have symptoms, we isolate that person and we do a swab. The change or the update is that if they had any people who were in close contact with that resident, any other residents, so perhaps their table mate, their roommate, if their spouse lives in the home, anyone that they've had that closer than 2 meters contact with, even if those folks don't have symptoms, the directive is that they will be tested. So we're working with public health. There is some challenges in getting swabs. So all of our homes do have swabs on site. However, fewer than 10 at each location. So public health is actively working to ensure that there is swabs available. So they're ordering, and public health is the group that distributes the swabs across the long-term care homes. The other new piece is that staff in close contact will also be swabbed. If staff have symptoms, then they are absolutely asked to go to an assessment center and be swabbed. Any staff that goes to an assessment center is encouraged to say that they are a healthcare worker, because those swabs will be expedited in order to ensure the protection of the residents and their colleagues.
Okay, thank you. You also mentioned that there's a directive now that all the staff wear masks. How are the supply of masks throughout lots of areas are talking about a shortage of masks. How are we doing?
So we're doing okay. It's monitored daily. There is an inventory list that is completed. The executive directors and their teams complete this list every day, and it's submitted to the province. We also work closely with Stephanie, who's supporting the local depot and is available to provide us some PPEs if we are starting to get short. Right now, we're in good supply. We're following the conservation guidelines, and we've trained staff on what that is. So they're supplied 2 masks a shift, and then if the mask is soiled, however wet or soiled, then they are provided another mask to change. And we are masking all staff. All staff are wearing masks, and that's for the protection of their coworkers and the residents.
Okay, thank you. Any other questions from members of the committee to Jennifer's report? We did have, did the executive directors want to speak in regards to individual homes? We did get the highlights in our report. Is there anything in particular that anyone wants to bring forward to the committee?
Mr. Vice Chair, I do see that Warden McQueen had his hand up, so he may have a question.
Okay, Warden McQueen has the floor.
That's okay. Thank you, Chair Mackey. It's more of a comment. I just want to say to you, Jennifer, and staff, we're supremely proud of the work you're doing. I mean, every time you watch the news at night, you're just so shuttled in the sense of hearing the news of long-term care facilities and the vulnerable people that are in those facilities. You know, you look at that one in Bob Cajun, and your heart goes out to that family and that community. So again, great work on you guys for all the work you're doing and staying above this. And I know you were ahead of it before others, and that's just speaks volumes. And I'll leave it at that. And again, as everybody has said, we're so proud and keep up the good work. And you know what? I want to tell everybody, tie a white ribbon around the tree in support of the frontline workers, because that's what it's all about, that ribbon, that white ribbon. So thanks again to you, Jennifer, and you, Mr. Chair. Thank you.
Thank you. Does anyone else have anything? Any questions? Jennifer, sorry, one more question. You talked about end of life medical decisions. What is being communicated to the families in regards to that? We heard things, you know, certainly on the media at Bob Cajun, you know, the doctor down there about not incubating and that sort of thing. What can you share a little bit with us?
Sure, I can. I'm just looking to see if I have in my notes here. So a letter went out from the physicians to encourage family members to be having these discussions about end-of-life care. And there is, this is in preparation and planning for if in the case the hospitals are at and above their capacity, then there will need to be preparations made in place for us in long-term care to provide end-of-life care in place, which means we would provide the supportive care in the long-term care homes. Long-term care has been providing excellent palliative care within the homes for as long as I can remember, and I'm sure long before that. So this is a discussion that is important for family members and residents to be having. It's not an unusual discussion to be having. So that's essentially what those discussions are. It's making sure that we have had those conversations and that we have everything we need in place to support people at the end of their life.
I'll just
Okay,
add,
thank you.
add to that, to what Jen's saying, that, you know, everybody comes to these places from a different perspective, and to help families to understand what the outcomes are and whether or not further intervention will do anything to improve the quality of that particular person's life. You know, just to help people to start to think about that, and the fact that, you know, they can be, if this becomes a situation where you're just trying to make somebody feel really comfortable, that the place where they are, their home, might be the best place to do that.
Okay, thank you. Warden, did you have your hand up? No? Okay, well, if there's nothing else, please stay safe, everyone, in our long-term care facilities, and have the best Easter you can. And we, as a committee, do appreciate the feedback, and look forward to seeing you all after Easter.
Mr.
Motion to adjourn,
Thank you.
moved by Warden, seconded by Christine. We
Sure.
stand adjourned. Thanks, everyone.
Happy Easter, everyone.